We have Councilperson Dominique Johnson present, Councilperson Thomas Keegan, Councilperson Manny Langella, Councilperson Diana Revolus, Councilperson Nick Saccinelli, and Councilperson Lisa Shanahan. And I believe George will be joining late. If we'll update the minutes if he joins. Do we have a motion for the approval of the minutes of April 22nd, 2021? I see Diana's hands raised. Thank you. Any corrections, deletions, omissions? All right, seeing none. All in favor of approving the minutes of April 22nd? So yeah, show hands. All right, in favor, opposed, abstentions. One abstention.
Wasn't present, so.
That's all right. Thank you. All right, moving to public participation. Just see if we have anybody waiting in the wings here.
We currently do not.
All right, thank you. All right, so we'll move right on to new business. Action item number 1 is a fire department item. Authorize the purchasing agent, Sharon Connors, to issue a purchase order to GAC DBA New England Traffic Solutions for the purchase and installation of security cameras and voice call box at 5 fire stations, bid number 4082 for the amount not to exceed $41,000 from account number C0641. Do we have a motion? Diana, thank you. Is there anyone here to speak on this item?
Assistant Chief Bassett will speak on it.
Excellent.
All right. Yeah, so this is a project that's a couple of years ago, and we started looking at a quote. We ended up upping it to the $40,000 for the total project. But we looked at the need for having some cameras outside our firehouse for security reasons.
I think we lost him. Yep, he's coming back. I see his window.
Well, I could fill in until they get our areas. Good on mute.
So the security camera for the firehouse.
We're losing you. If you try, maybe try without video. No luck.
Go test session. Yeah. You there?
We're still losing you. I don't know if you could hear me.
I can. It keeps going to the testing session.
Yeah, you might want to leave and come back.
Okay. If the chief wants to jump in on that, knows what we're with.
Yeah.
Okay.
Chief, we could move if you want to wait for the assistant chief.
I'll update
Okay.
you until he gets back, if he comes back. Last year, we had asked for $20,000 for security cameras to be put at the different stations for the main entrances. And we didn't use the money because we had, or Albie had several vendors come in and they did a walkthrough of every station with recommendations as to, well, you guys should have one over here. You should do this. You should have intercoms that go directly to dispatch. So if somebody came to the door when the apparatus is out, they could press the button and speak to dispatch directly, especially if they have any type of medical problem or if they want to report a fire, whatever, they could speak directly to somebody. So that amount now has increased to 41,000. So it's a combination of the 2 years. And we asked for 21 for this year. which was approved by, I guess, Henry and the mayor. Albie, you back? Unmute.
There we go. Yeah, I'm back. I'm on the cell phone now, so it should hopefully good.
Welcome back. We can hear you loud and clear now.
Yeah, and I caught the tail end of the Chiefs. The big thing was the direct line to communications in case somebody rings the doorbell and we're out on a call.
Any questions from the group? So Chief, you said that this was distributed across 2 budget years. We just didn't move forward last year. Was that?
Yeah, under recommendation of the different vendors.
Okay. And then, but did you identify new locations? Are we going with the same, is this the same location, same number of cameras, or?
We never, when I took over the project in 2020, we really couldn't do what we needed to do to do the job correctly. So when we've talked to our first vendor, it's, doing one camera on some of the firehouses really didn't provide what we needed. And there wasn't a guarantee we could get them all with the voice boxes. So that's why we had to increase it. So we never started it. We really were just in that original exploring what we can do with the first bid.
I understand. All right. Any other questions from the group? All right, we have a motion on the floor. All in favor, show of hands. All right, it's unanimous. Thank you.
Thank you.
All right, we have to. I'm going to move to suspend the minutes to add the police item that you should have all received an email. I'm going to read that on now. 1A, authorize the mayor, Harry W. Rilling, to execute an agreement with BadgeQuest, Inc. to conduct the police promotion testing for the ranks of detective, sergeant, and lieutenant for a sum not to exceed $39,000 from account number 013049-5258. And item 1B, authorize the police chief, Thomas E. Kohalik, to execute any and all agreements, documents, instruments, and amendments thereto as may be necessary to implement the police written promotional testing and assessment center for the ranks of detective, sergeant, and lieutenant. Now, first, vote on suspending the minutes, I believe, is appropriate. Is all in favor of suspending the minutes to add the item? All right, that's unanimous. And now just, would anybody like to move item 1A and 1B? Mr. Keegan, thank you. All right, so who do we have to speak on the police items?
Hey, so Chief, how are you?
Hey, Chief.
So our promotional lists by contract are valid for 2 years. So every other year we have to bid for new testing to create a new list for each rank as openings become available. So we went out to bid and we received just 3 bids for the testing process. And as you see in your packet, we had the bids from BadgeQuest was for $37,500 total. The bid from Industrial Organization Solutions was $76,365, and the bid from Morris and McDaniel was for $98,000. Sharon Connors and Purchasing had a selection committee review the bids and also the pricing, and they selected the low bid $37,500 from BadgeQuest, which is also the vendor we've used for the last several tests, and we're very pleased with them. So we're happy that they were also the low bidder for the contract.
Thank you, sir. Any questions from the group? Discussion. Why such a disparity between the next lowest bidder?
Yeah, every time we've bid this, that's what's happened. There's usually been 2 local vendors that are small companies, BadgeQuest, and there is a company called Resource Management. The 2 of them would bid, and they'd usually be within 5 to 10,000 of each other. And then these national companies are always 2, 3, 4 times. We've had, I think the last test we bid, IACP, the International Association of Chiefs of Police, bid, I think, over 100,000 for the test. I don't know that the big companies really are interested in the contract unless it's really worth their while. But BadgeQuest is out of Massachusetts. They do a lot of Connecticut and Massachusetts police and fire testing. So they're comfortable. Their overhead, I guess, is lower. I can't explain it really. It's
No,
crazy.
That's fair. They probably just know what it takes to win the deal, right? So they're going in at that price that they're familiar with, as long as they're profitable. I'm guessing, right? But you're satisfied with their services? We've used
Yeah,
them before?
we've used them for the last probably 3 processes, and they handle everything. The assessment centers, they actually pay assessors that are at least captains or above, and usually they're chiefs or retired chiefs to do the assessments. So they do a good product.
Excellent.
And just to be upfront, I also do consulting for them as an assessor for them from time to time. I was not on the selection committee for that reason.
I appreciate the transparency. Any other questions from the committee? All right, we have a motion on the floor. All in favor with a show of hands? Aye. All right. And George joined at 7:10. We'll just let the record show. And I see a show of hands. All right, it's unanimous. Thank you. Thank you, Chief. All right, now, if everybody is okay with it, I'd like to change the order of the discussion items. So the firework enforcement is the first discussion item, because I think that involves multiple departments potentially, and then we'll go into the normal cadence of departmental updates. Everyone okay with that? Any objections? All right, fantastic. All right, so the first discussion item is going to now be firework enforcement, and this comes from the lens. This comes back from the talk track that started last week, and also somewhat supplemental to what's going on in the ordinance committee, where ordinance is looking to be able to enforce some level of they want the fire inspectors to be able to go into retail locations and authenticate that the fireworks that are being sold are legal. Ms. Shanahan, is that correct? Okay.
Yeah, we're just looking to make sure that they're just selling sparklers and fountainheads and not other types of fireworks that are louder.
Excellent. So, and this is on the back of that body of work, where essentially if something was not sold in Norwalk and something was brought in across the borders, and we know it's not a CT legal firework, the question was, what is our current process around enforcing follow-up, et cetera? So I think, and then also as a part of that, we did talk a bit about, is there anything that we do on the preparedness side if there was ever some type of fire caused by these? So I think the first line of questioning and discussion is probably more on the police enforcement side of things. And then we could follow through and see if we want to talk and dive into a little bit deeper on the fire and enforcement and preparation side of things. Is that fair? Is that how the group wanted to handle this? Yes. Okay. So I guess, Chief, the first I guess what we need to lead into is what is current protocol around firework enforcement. So a complaint comes in. We know that it's something, it's an aerial explosion, something that we know is not CT legal. Like what's enforcement look like there, follow through from receiving the call to fruition?
Yeah, so it's handled basically like any other complaint. The dispatchers, if we'll get the call, they don't really get into too much of exactly what type of firework it is. If somebody complains that it's either loud or they see whatever, or they see, even if it's a legal firework that's being used what they feel is in a dangerous manner, say it's in a crowd in the street or whatever, dispatch will dispatch an officer or two, and then they'll go and investigate and determine, first of all, if they can determine whether it's a legal firework, and then if not, if they feel a criminal enforcement is required, or just a warning and the people are cooperative. Obviously around the 4th of July, well, actually last year it started probably now, but every year it seems to start earlier and earlier. But most of the complaints, I would say a lot of them are really for loud explosion, firecrackers, M80s, that kind of thing. And people are just calling them in. They hear them in the area. Sometimes it's hard to determine where they came from. We have had a couple locations where residents have purchased illegal displays out of state and had a picnic or something, and then had their own fireworks exhibition, so to speak. In one case, they were warned ahead of time, and And last year, I don't believe we had a problem at that location, but we will, I'm sure, have some residents where they'll have major fireworks displays that we'll have to respond to. And then again, take whatever action is appropriate depending on the cooperation level. We get a ton of fireworks complaints, so it's a challenge.
Thank you. Discussion from the committee. Any questions? Are we, Mr. Keegan?
Yeah, thank you, Chairman Sachinelli. Chief, is there anything that we can do proactively? Is there anything thinking out of the box, just as all of us on the committee, yourself, this has become really a quality of life issue in many areas of Norwalk. And having sat in that car and, been responding to these, fireworks complaints in my own career, and unless you're right there when it happens, there's not a lot we can do. So I was thinking a little bit about this because we've been discussing it over the last month or so, and any thought of having a tip line? And by that, I mean, not just call into dispatch where, they take the information, it's anonymous and they send a car. But I'm thinking that someone could call a dedicated tip line like you would for a major crime. And it would be dedicated to fireworks complaints where, for sake of a better way of saying it, you could rat out your neighbor. Maybe you have a child or a dog or something, and, you don't want to be confrontational with the neighbor and you don't want anybody to know, but a lot of people have had it. And it seems that the people who do blow up the loud fireworks, they do it on a continuous basis. They just have a couple of them. This goes on and on and on and on. So it's just a thought I had,
Yeah, we do have a tip line that's in use for any purpose. And to be honest, we don't get a lot of activity on that. Where we do get most of our anonymous tips is through our new app, the text to tip, the Tip 411 app. We get a lot of anonymous reports ranging from abandoned cars to dog issues that are ongoing where neighbors, like you said, don't want to be identified that they're the one that's complaining about the neighbor's dog or whatever, to drugs, to crimes that have occurred where people have information. So one thing we could do, which we had not done, we didn't have this app in last year or before. This is fairly new. One thing we can do is do some social media and outreach, kind of advertising the fact that if you'd like to give us information proactively, use that text to tip. It's an app. You can do it on your phone, or you can actually still go on the internet and do it. But it's very simple with the app to just send us information anonymously. So we could do that and more proactively ask people to give us information in advance. And also to that point, as I mentioned, we did have a residence that was a continuous problem each year, and we'd see the remnants, out in the street after, and we ended up contacting them in advance and kind of warned them that we were going to be watching and, don't do it. And they stopped. So, if we do have information ahead of time, that might be something that will work a little bit. Because I don't see a lot of huge displays in a lot of areas. There's a few, but a lot of it is smaller, quick things, as you said. So the texting the tip in or tip 411 on the app is something we could try.
We could, Chief, maybe we could work with Josh to distribute that as well.
Yeah, we can work with the city and also our own social media and get something out. And I know that I don't know if Michelle or Deanna's on. I think they're both on, but I know that usually the fire department, along with maybe the health department, will put some information as far as the dangers of fireworks, that kind of thing. So maybe we can kind of combine it all into a more broader message and work together on it.
And any other questions from the group? Discussion. With all of the fireworks displays being canceled, the citywide fireworks displays being canceled locally, are we is there an expectation, or has there been rumors? I know you guys are pretty vigilant on social media as well. That there's going to be more private displays?
There hasn't been that we've seen, but based on last year,
It's got to be right.
I mean, last year, not just Norwalk, last year, every town had these issues because they canceled the main fireworks, so people went about it on their own. So there was a lot of problems last year. It was one of the worst years for fireworks. I also think that the availability outside of Connecticut, because in a lot of places, they're legal. So it's very easy to take a few hour drive and load up and come back. And then I also wondered, to be honest with you, even it's hard when you're looking at a small, mom and pop store selling fireworks to see whether those are legal or illegal or what they actually do, unless you're familiar with them, because sometimes the markings are kind of difficult to understand what the actual item does, because every state's different. So they won't say illegal in this state or that state. It's just the type of firework it is, and you have to kind of know.
That's a good point. It's an interesting take. Diana, Miss Revolution, sorry.
Said that we have proactively talked to mainstream vendors as well.
I don't believe we've ever done that, as far as like Walmart, you mean, things like that?
Yeah, because they had it.
I'm sorry?
Yeah, because they had it.
They
had the fireworks. So last year, and again, we've also said that there was a change in what we were selling anyway as well. So there were major vendors selling inappropriate fireworks. Have we talked to them as well? It's not just mom and pops.
Yeah, I'm not aware of Walmarts and those selling illegal fireworks. They may have, but I'm not aware.
Last year, I just was surprised last year where I saw them. Like I saw them everywhere, like a CVS, a gas station, a Walmart. I saw them everywhere. So and I think not to misspeak, but just because we're trying to get some type of revenue off of these type of fireworks, just giving a little stipulation, some major venues, not to dabble and dip there, because they could get it right here.
So Chief, is that something that you would imagine you'd want us to call in on the tip line if these things are being sold?
That's what we would ask, yeah, if somebody sees it. And again, it's very difficult a lot of times, and you may think that they're illegal, but they're actually not. They're just by the way they're marked. Because as long as they're ground-based, and there's a broad range of ground-based fireworks, some of them are, the fountains and things like that, can really look like an illegal firework when in fact they're not. So it's only aerial and exploding fireworks that are illegal, generally speaking.
Yeah. I think it's very clear to see though what's ground-based and what's not. Like you can tell one that is not ground-based. I mean, I can expecting the boom versus aerial, whatever, but when you see one that is not ground-based, it's very easy to point out.
Can I just add to that?
Yes, sir.
All right. Per the fire code, state of Connecticut, they're only allowed to sell sparkler type fireworks. And the big box stores, part of the code descriptions is that it's got to be a sprinkler building. They're only allowed to have like between 1 and 200 pounds of product inside the store. Those vendors, I'm sure, are doing it legally. What we're trying to do through the firework permit is to be able to control who sells the product, because if you don't meet the code requirements, we're not going to sign off on a permit, and therefore they won't be able to sell them unless they do it illegally. And that, unfortunately, we can't control. And there's going to be that out there for sure. So I hope that helps a little bit.
That helps a little bit though, too. I would give that. Just, yeah, that helps a lot a bit though.
All right. Any more general discussion on the fireworks enforcement topic from the group? Any other questions? And everyone kind of satisfied? We have a kind of a level understanding of what the enforcement looks like. There is a tip line. So I do, both chiefs, thank you for entertaining that talk track. I appreciate it. All right, so moving forward, so emergency management update and discussion. Mr. Luca, how are you?
Good, how are you?
Excellent, thank you.
Not a whole lot. We did finish the USDA Farm to Family program this week. So that program has been in effect for almost a year. So the city of Norwalk had been getting USDA Farm to Family boxes, and we've been working with Cornerstone Church to distribute to the agencies. About 1,300 boxes per trailer. Again, usually about once or twice a month. So again, today was the last delivery of the program. And we are looking forward to seeing what the USDA and Department of Agriculture comes up with for future feeding programs. Again, we think that they'll probably start enhancing more of the traditional SNAP programs and the programs that have been in place for a while, and probably not lean towards these distribution sites or distribution boxes. But we'll definitely keep following what is going to happen with that program and others. And then obviously the Connecticut Food Share Program, or Connecticut Food Share Food Bank distribution at Vets Park continues Wednesdays at 8:30 to 11:30. And we will look at some of the messaging just to make sure that's a little bit stronger, because I think people are still getting confused and going to the beach. I think I mentioned it last month that we are looking to do the open house again in September, which is focused more public safety and DPW. So again, COVID permitting, we should be able to do that, and are looking forward to another good event. And then hurricane season starts on Tuesday, June 1st. So we are looking at doing a disaster tabletop exercise, probably through Zoom, unfortunately, on June 9th for the city. As we do have a lot of newer employees. And again, folks haven't been back in a while. So that really is the main focus right now. And obviously community preparedness, making sure we do some press releases and push out some messages on hurricane preparedness. And that's it.
Thank you. Any discussion, questions from the committee? The press releases and updates to the public around the hurricane season, do we put those on the website as well? Where do those live?
Correct. Usually the traditional press releases will go out and be on the main page. Right now I've got a summer spotlight. I think it should be up by now, focusing on summer safety issues. Probably in late August, early September, we'll switch to a hurricane spotlight. But then I also have on the emergency management page, the hurricane information. And usually what I'll try to do is, again, last year was a little bit weird, obviously, but again, keep pushing messages out probably throughout the month of June. So pet preparedness, financial preparedness, just to keep the word out. And then also on the same summer spotlight, post some hurricane information as well. This way it all kind of ties together.
I always try to share those. You actually send out the most accurate weather information of. You picked the wrong profession. You could have been a meteorologist easily.
They make fun of me, but thank you.
No, I love it. I love it. I go by it like it's the only one I look at, actually. And now that we're starting to go back to live events and public events, is there any thought around the what do we call it? The kind of in my head, I want to call it the Touch a Truck event. It usually that takes place in the summer.
Well, we have the one in the open house is the big one that we do at South Smith Street at the Public Works facility. Yep, that's the so that we have scheduled, I believe, I'm going to say September 25th. I think that's a Saturday, or it's the 23rd, but it's that last Saturday of September. So
Okay.
we already have the date picked, and hopefully, again, COVID permitting, we'll be able to move forward with that one.
All right, fantastic. Thank you. All right, I think,
Mr. Chairman, I think
Yes,
you're
sir.
thinking about the touch a truck at Shady Beach.
no, is there one at Shady Beach as well?
Yeah, there's an outside organization that comes in and gathers a bunch of trucks, and kids go there and play all over them.
So I think what Michelle, the open house is what I was thinking of, but I wasn't aware that there was another Touch a Truck event. Does that usually happen in the summer?
Usually it's the Human Services Council touch a truck event. It's either sometimes it's like a week or two before ours, or sometimes a week or two after. Again, depending on where everything falls, because usually we look at the schedule for the boat show, the oyster festival, and then kind of make sure we don't do our events on the same day. But it is that late summer, early fall.
That's outstanding. I guess I tend to miss that one. So we'll stay up to date on the website. But if as we get closer, if you wouldn't mind reminding us, so we could start publicizing it through our own social media. Those are great events.
Yep, absolutely. I am trying to convince TPW to name their plow trucks, and let the community name the plow trucks. They haven't quite gotten on board with that one yet, but I'm working on it.
What would you name the plow trucks? What's your first choice?
There's actually some amazingly creative ones out of Scotland. They did, again, a great promotion because everything is GIS located. I can't remember them off the top of my head, but some of them are amazingly funny and creative. So like I said, we are, every once in a while, I bring it up. So
I think it's hysterical. I'm a Top Gear fan. If anybody else is a fan, and they made reference to, I guess in the UK they did something similar, and the only one that I can remember, unfortunately, was Jack the Gritter. But there was some very creative ones that came out of that.
yeah.
All right. Well, if there's no other questions, we'll move forward. Thank you, Michelle.
Thank you.
All right, we're moving on to the fire update and discussion. Chief.
Okay, thank you. Hello, everyone, again. So I'll just go run down the calls that we had for the month of April. 547 calls, averaged out to 18.2 per day. 16 fires, 5 building fires, 1 vehicle, 2 cooking, 5 brush fires, and 3 other. 43 rescues, which are mainly motor vehicle accidents with or without injuries, motor vehicle versus pedestrian, elevator rescues, and 2 watercraft rescues. We had 316 emergency medical calls, 21 hazardous conditions, which are gas leaks or spills, carbon monoxide incidents, 19 public assist calls, 42 smoke scares, good intention calls, 90 different types of fire alarms, either unintentional or malicious or malfunctions. So the difference between 2020 and 2021, we are at minus 14 calls from last year at exactly the same time. So 3,323 calls. April 2nd, we had 2 structure fires, came in pretty much simultaneously. One on 7 Button Ball Trail, which was a bedroom fire, and then on 38 Mar Drive, was a fire inside of a wall around a window frame. Then on April 4th, Rowayton had a house fire that we went down and assisted with that. April 4th, we had a fully involved car fire on the thruway. April 9th, we had a kayaker overturned in Calf Pasture Beach area, and he was treated for signs of early hypothermia and transported to the dock, and the Newark EMS took over. April 15th, we had electrical meter shorted out on the outside of a house and caught the exterior of the house on fire, and that was extinguished. The fire marshal report For April is 184 inspections. They have made 89 notifications, 49 plan reviews. There were 5 liquor license permits. 7 fires were investigated. Total 334 incidents, and the revenue brought in was $3,125. So to answer Ms. Johnson's question about the COVID vaccinations, we have been tracking the members since the health department allowed us to get our first vaccine. We were tracking every member who wanted to get the vaccine and who didn't want to get the vaccine. And to this date, we have a total of 134 possibilities or members. We have 82 that actually have both shots, and we have 52 that did not or wanted to wait for the shot. But out of that 52, 12 actually contracted the virus. So I'm not sure if they feel that they have antibodies, so they're not going to take it. And the percentages were very close to 70% of the department is fully vaccinated. And the last statistic is through the course of this whole pandemic, we had 18 people come down with the virus. One was in the hospital for a week. He's still out, but he plans on returning pretty soon, and everybody else has returned back to work. So one more thing on the recruitment drive. Did that answer Ms. Johnson's question?
Just for the membership and the public, the question, Ms. Johnson had prepared some questions in advance of the meeting, which were forwarded over. So essentially the question for police and fire is, are we tracking vaccinations amongst personnel? Ms. Johnson, is that fair in summation?
That's fair. It was
Okay.
the idea of if we're able to track, then how are we doing? So thank you, Chief, for that. I can't imagine, just as a quick follow-up, that there's a requirement. I think we talked about this before, but I'm assuming your numbers also cover EMT as well.
Well, we have members that are EMTs. We have members that are emergency medical responders, which is a little lower classification, but these are members in general, a firefighter. We cannot make it mandatory to get their vaccination.
Okay.
So, I'm trying to get everybody to change their mind, and we're getting there, but it's not, it's not happening overnight.
Thanks for that update, Chief Gatto.
Okay. The recruitment drive, the entry-level test, we just had that May 22nd and May 23rd at Brian McMahon High School. Before the exam, we had 1,220 people actually sign up and wanted to take the written and oral test. Between the 2 days, the way this company gave their exam is you either pick Saturday or Sunday, and they gave you the written exam and the oral portion on the same day. And you could take your oral first, or you can take the written first, and then you swap or flip over in the afternoon. So I'm not exactly sure the final numbers, but I believe we're around 1,000 people. And typically it's 10 to 15% of no-shows. So that the testing company was not worried that we only had 1,000 people. So in about 2 weeks, we should get all the results back, and then we'll go from there. Everything went well. Thank you to the the principal, Brian McMahon, letting us use the school. Everything worked out great. So, questions?
Just a quick question. When you were going through your prior update, you mentioned a good intention call. What constitutes a good intention call?
Somebody, they call up and they say, I think I see smoke coming out of the
Gotcha.
the residence door, and then you get there and you find out that it's a barbecue grill in the backyard, or it's a dryer vent, things
Got
like that.
I
Those
thought it was
big-
something similar, but thank you.
Yeah.
Any other questions from the committee? And Chief, I appreciate the updates, very thorough as always, and I'm happy to hear that the recruitment is going well, because that was definitely something in the back of our minds for some time. So that's fantastic. Thank you.
Thank you.
All right. The next item on the agenda is the Health Department update and discussion. Ms. Diamore, how are you?
Good evening. I'm doing well. How are you?
Excellent, thanks.
So I'll give some quick updates, then I'll pass it on to Brian to give a situational awareness update for where we are with COVID. So our vaccination efforts continue. For the month of June, we'll actually be at the Maritime Aquarium every Wednesday evening from 5 to 7 p.m. Vaccinating. You recall we were at the Bowtie Cinema, so we're so thankful and grateful for that partnership. And now, as the cinema has opened up, to the public, now we're at the Maritime Aquarium in the evening, so we're really grateful to them. Right now, we've been offering Moderna and J&J, and we're also now working on a transition to be able to offer Pfizer. So we're working on that. So hopefully, future clinics will be able to offer Pfizer. We're also setting up additional pop-up sites within the community, working with our community partners. And we're also working with all the other vaccine providers in Norwalk to coordinate different locations across the city, as well as vaccinating the homebound population. We've utilized some grant funding recently to hire 2 full-time contact tracers. So we're excited to have them on board to help us assist with contact tracing. We've also submitted multiple grant applications through state and federal agencies to sustain and expand our community health worker program. If you recall, you all approved a partnership with the Family and Children's Agency, with the Connecticut Health Foundation to hire community health workers. And we're looking to enhance that model and to expand it to beyond COVID in the future, to focus on chronic disease prevention as well. So we're excited about that potential. And that's the main updates for the health department. And then I'd like to just pass it on to Brian, if that's okay, to give his updates.
Thank you.
Sure. Hey, everybody. Just give me a second to share my screen. Let's see. There we go. All right. So it should be coming up. There we go. All right. So, hey, everybody. Brian Weeks here, epidemiologist at the Norwalk Health Department. So again, I'm just going to do a quick overview of kind of where we're at with the COVID situation for the city. So what you should be seeing on your screen right off the bat is, the state health department's COVID-19 county indicators. So these are obviously the leading and secondary indicators that are used to kind of get a better understanding of what's going on in the various counties. And so what's really cool and great is, this is the second week in a row where for leading and secondary indicators, all the counties are in the low category, right? So this is really great. So we're not in the red anymore. We're not even in the orange. We're in the low category. And we're getting, as the current trends are indicating, we're having a downtrend. So we're getting there closer to maybe even getting out of yellow. So let's just have our fingers crossed. But nonetheless, we're still going to see the impact of obviously the loosening of various state regulations, restrictions, as well as obviously a lot more travel and other things happening. So things can always change, but nonetheless, it's a good trajectory that we're on. So kind of looking at it from a city and town basis, another great thing here too. This map, from an artistic point of view, obviously not as nice in terms of being very colorful, but this is kind of the mundane gray is kind of what we're all shooting for, right? Because we want to have case numbers that are obviously very low. And as you can see, for even a lot of the large cities, except say for Hartford, we're in the yellow. So we haven't been in this time period since last summer in 2020. So that's something to really kind of keep in mind. So it's really great. Fairfield County definitely demonstrating, that yellow and just gray kind of aesthetic right there. But obviously you can see there's some cities and towns that are still in the orange, as well as one that's still even in the red, which is Putnam. So really good. So we're at 7.3 cases per 100,000 of the population. Again, keeping in mind with surveillance data, it's reflective of a 2-week period, the way the state's doing it. And so this is from May 9th to the 22nd. So that's still 5 days out in terms of that surveillance data. So keeping that in mind as well. Just really quickly, in terms of the city itself, based upon the state update that they just provided today. So again, this meeting is very fortuitous because it comes out just like an hour or two after the state releases their data, a new update on the weekly basis. So we're at about 11,514 cases for the city itself. That was from compared to the previous day, just an increase of 2 so far with 224 deaths. But it's also interesting here looking at just the case data. You can see how kind of the usual suspects again in terms of age groups. So the less than 50 years of age. So you can see how right now the 30 to 39 year old age group is the largest proportion, so at 18%, and then almost tied at 16.9% each is 20 to 29 and 40 to 49. But we still have those younger age groups. Those are especially obviously ones that are more susceptible given the fact that the vaccination is not fully eligible, especially the 0 to 9 age group, but also part of the 10 to 19-year-old age group. So 15.7 for 10 to 19 and 12.4 for 0 to 9 so far. So again, in terms of messaging, we really want to just make sure we reach everybody that's less than 50 years of age, nonetheless, still not ignoring the fact that we still have cases in these older age groups. Again, this is reflective of surveillance data from May 9th to the 22nd. So obviously, again, talking about the other side of it is in vaccination efforts. So this is the state's update for up to May 26 in terms of the COVID vaccination data. So this is showing cases that at least received 1 dose of the vaccine. And for the city of Norwalk, we're at 60.06%. So that's actually really great. Technically, keeping in mind that this is showing for all ages. So again, this is accounting for ineligible age groups. So when you factor in, if still not perfect because, the eligibility is for 12 years of age and older. But based upon the state's availability data by town and city, if you look at it for 15 plus, technically for initial doses, we're really around 72, 73% based upon census estimates. So even better than this when you kind of discount for the fact of the ineligible age group. So really great, actually. And obviously partially indicative of what's going on with our case rates and case numbers. Obviously also just with the better weather because there is some seasonality tied to COVID-19. So the other thing that obviously we got to keep monitoring because that always can change the status quo is the variants of concern. So state just provided their new update. This data is reflective of March 2nd to May 15th. And as you can see, it's been kind of holding steady based upon the state's assessment of specimens, keeping in mind that, it's not a perfect system and only a small proportion are actually fully sequenced to get this data. But it's somewhere around 40% for B117, which is the UK variant. So that's the one to keep in mind compared to the previous garden variety of COVID that we were dealing with, has a 50% increased transmissibility. So when you look at it more from like the CDC and the global and national databases, relative to kind of like a sentinel surveillance, essentially what they're doing, looking at from each state, this gives a better idea of the proportions. And so, you're talking about 55.5%, if not 56%, in terms of the UK variant, again, B117, as being obviously the predominant variant concern in the state of Connecticut. So again, something to account for, and it has been, steadily increasing as well. P1, which is the Brazil-Japan variant, is also increasing very slowly, but at 3.6%. Naturally, obviously, you guys probably been hearing the news too about like the Indian variants. They're so far still qualified as variants of interest, but naturally, as more scientific understanding and research is conducted on it, it may be increasing in terms of classification. So something we're closely monitoring, especially right now with the UK and their relationship with India and how they're getting at least initial exposure to it. So there's going to be further understanding and research related to that. But nonetheless, just to outline the fact that the data I just mentioned here from the CDC, this is relative to 4 weeks up to May 8th. So again, you have almost 19 days now from that time period. So again, not fully reflective what's going on right now, but this is, in terms of data quality and other things that have to happen, this is, the most recent viewpoint we can get, but it gives us a great opportunity to kind of extrapolate from there. So, kind of going back to my earlier point, one of the most important things I would like to emphasize, obviously, you all probably have seen.
Brian, before you leave that slide, how many variants are there in total? I saw 13 variants. Is that all of the variants, or are we still discovering variants? Or
excellent question. So with variants, they're happening all the time, right? Every day, new variants are being developed, new mutations occur, just like if you have with, say, HIV or flu. The catch here with COVID, and the variants, what the mutations actually result in. Some of them don't really change the virus too much. Some might actually increase or decrease its infectivity, whether that's its affinity for certain cells in the human body or relative to the viral load that somebody might expel when they sneeze or cough or even speak. And so that can kind of factor in the success of that virus to spread. Now, the other big thing is obviously where it happens, right? If somebody's not following the proper prevention measures, right? Because that's really where you can stamp out even variants that can cause very severe outcomes. If they're in a high density area, people are interacting quite a bit, not following those protocols, that still gives ample opportunity for variants to succeed and then start becoming like what we've seen with B117 and the others. So to answer your point, yeah, these are the ones that are currently really a major focus, but there's obviously a lot of other variants and variants that are developing every day. It's just a matter of what success they have in making it to the general population and spreading from there and becoming more of a global phenomenon as we see with the pandemic. But it's something that obviously a lot of authorities are taking very seriously and doing a better job monitoring now that obviously we have more infrastructure in place to do that. But still factoring as I mentioned before with sequencing, it's only a small proportion of specimens that are sequenced. And obviously they usually have some sort of factor associated with them that makes them a specimen of interest. And then some of these specimens are only sequenced if obviously the individual that's, it's coming from actually gives permission for that too. So there's also those kind of limitations to factor in as well.
And you probably won't be able to answer this, but in your research here, are we starting to think that these variants, because we never, correct me if I'm wrong, we never previously tested for this, right? So is there possibility that these variants were always out there, or are these actually mutations of something that occurred more recently?
No, that's an excellent question. I mean, when they kind of look at the family tree of COVID and, kind of look at, there's various things you can look in terms of genetic research and to determine like polymorphisms, things of that, things of that nature that you can tell where it's kind of started entering the picture in terms of timeline, a rough idea. And obviously also having the adequate research support to kind of look into each one to study that. So these variants of interest and concern more likely have been, tied to the recent development of just standard, SARS-CoV-2, right? And the one that we're really familiar with. But obviously when, somebody does get tested, and there is some, especially with antigen testing, there is some cross reactivity. There are obviously a lot of coronaviruses, right? It's a pretty large group. And so those exist, there's the Hong Kong variety. Obviously there's the original SARS and all these other ones, obviously not spreading or in existence at the level of, as we see with the pandemic. But yeah, these are obviously ones that are bigger of interest or concern as, recent developments have been made. But, there still are obviously a lot that are probably not detected at the moment. So, that's something we're all working obviously to monitor very closely, but still it's a lot happening, as you can see. And, fortunately with us, with the summertime and, vaccination rolling out, which, even if it's not fully effective against certain variants, it does reduce the severity of outcomes because the body is kind of somewhat familiar with the virus at that point, or at least knows how to manage it. We still obviously have a hill to climb, so to speak. So let's not push the prevention measures too much, right? That's our best arsenal, our toolbox, along with the vaccination.
And did you say that there was a variant that was more vaccine resistant, or?
Yeah. So the variants of concern are obviously the ones that are classified because of either their increased transmissibility or because of their ability to impact the effectiveness of certain therapeutics as well as the effectiveness of the vaccine. So the South African variant, definitely, the Brazil and Japan variant, as well as the California variants, 427, 429. They have some demonstration to have the ability to neutralize the effectiveness of, either therapeutics or vaccination. So something to closely monitor. B117 still is a bit on the fence in terms of how much it actually impacts the vaccine. It's just known that its transmissibility is much higher. And, in terms of severity compared to the prior versions that we're familiar with, the garden variety COVID, it definitely seems to have some increased risk of hospitalization in comparison to that as well. And so, again, all this research is, we're kind of living in the moment with the research happening and obviously with the scientific community vetting it and then releasing that. So, there's, as evident with just the data itself, there's going to be time lags or time latencies tied to it. But obviously, everybody's doing their best to try to stay on top of it as much as they can.
It's very interesting. Thank you.
Yeah.
Sorry to poke at that one slide. It was just an interesting slide. I never saw it late. I haven't really poked at it before. So thank you for.
Yeah, no problem, man. And I'm always planning to kind of bring it up because the variants are obviously the big game changer for this whole process. But And that kind of leads in again to my, this slide here. The CDC still does have recommendations, even though the state doesn't have a mandate in terms of travel anymore. The CDC has recommendations for domestic and international travel, and it's stratified by those that are not vaccinated and those that are fully vaccinated. And keep in mind, as much as it may seem like mundane terminology or semantics, fully vaccinated actually is very specific, right? It's implying somebody's received the full series of their vaccine, as well as they've been given essentially 2 weeks after receiving their last vaccine to develop the immunity there. So factoring that definition into it. So if somebody's got 1 dose of the Moderna, they're not technically considered fully vaccinated, right? So they would still kind of meet that not fully vaccinated category. Essentially, that's this category here. So that's really important to emphasize when people travel, because that's where a lot of these variants that might be, successfully spreading, say, in other countries that may not obviously had as severe COVID as we had. India's kind of late to the game in terms of their presentation. But if there's new variants, we can kind of prevent those from making its way to the United States. So everybody's doing their part in terms of just following these measures and being aware of it. So this is just important in everybody's, the various capacities in which they engage the public or have messaging to the public, just emphasizing that point, because this helps protect us from introducing this or delaying at least the introduction of certain variants as much as we can. And nonetheless, obviously emphasizing the prevention measures to really curtail that as much as we can too. So those are kind of the items I just wanted to emphasize, but and that's my kind of presentation here. So thank you.
I appreciate it. That was fantastic. Thank you. Any discussion or questions from the committee?
So Brian, this is Lisa Shanahan. I'm just curious about the breakthrough infections with vaccinated. Do you have some statistics on that and any information?
Yeah, I don't have the number right offhand, but I know that the state health department did release a presser, I think a week or two ago, and it's a very small number in terms of breakthrough. Now, obviously, it's hit the news too. I don't know if you all heard about it too. The CDC is obviously not focusing on breakthrough cases that resulted in incredibly mild illness. And then obviously you have to consider the fact there might be breakthrough cases where somebody presented with no symptoms at all. Obviously that's kind of difficult to detect unless somebody was undergoing routine testing. So right now, I think the CDC is overlooking that in lieu of obviously much more severe hospitalizations or death outcomes related to breakthrough vaccination. But if I recall correctly, I think it's a very, very small percentage number. I'll try to dig that up.
Brian, actually, I just dug it up right now. So what they shared in Connecticut is that in fully vaccinated individuals, it's rare. It's less than 0.1% of Connecticut's fully vaccinated persons reported to DPH as having contracted the virus.
Thank you. Any other questions?
Yes, it's Dominique.
Yes.
Hey, hi, Brian. Hi, Deanna. Are we seeing, and I don't know if we're tracking this, but are we seeing fewer folks come to get tested for COVID now that the vaccination rate has picked up?
Yes.
I would say at this point. So I'll start off. What we're seeing is definitely a drop off in terms of individuals seeking testing. Some of the surge capacity that's been developed throughout the state and the state contracts for COVID testing has been, obviously decreasing in terms of obviously the need too. Obviously, there's other healthcare institutions or facilities that are still standing it up, whether it's an urgent care center, hospital sites, or, all these other kind of facilities and individuals that are helping with these efforts. So, it's naturally kind of coming with decreasing case rates, the loosening of restrictions and regulations relative to COVID prevention measures. And it's kind of expected, but naturally, this is something that probably will come back in the fall as we potentially anticipate some level of COVID kind of coming back as a result of, more indoor activities, less opportunities, social distance, things of that nature. But by then, we might be better equipped, obviously, with more people being vaccinated that might just totally prevent that. So we're all looking forward to that. And so again, taking full advantage of the summertime to really make sure everybody gets vaccinated, because not only helps them, it helps others too.
Great, thank you.
So this is going to be around longer than a week. I figured 10 days at the most. Any other questions? Brian, Deanna, that was Brian, that was a fantastic presentation. And Deanna, as always, thank you. That's it's great. Thank you for all you're doing.
Thank you. Guys.
And
That was great.
we're this group that you know is always here to support you.
Thank you.
All right. And before we go to the, I see screens coming back on. Did anyone have any questions? All right, fantastic. All right, so moving over to the last discussion item of the evening is the police update and discussion. Chief Kohalik, you still on? Did we lose him? Oh, there you are. Sorry, the window's all shifted on me.
I think what I need to do is when we prepare the agenda, I got to change the order so that we go first next time.
You know, you have the right to do that. Like you, of everybody, you have full control over that. Huh?
I felt guilty doing that, so I had to put us last all the time.
Oh well, thank you. The floor is yours.
I don't have a lot to report. Just a couple things. I apologize about the vaccine. I don't know if you sent that to me for discussion because I don't recall seeing the email. But what I can, if that's still an issue, you're looking for information, I can tell you off the top of my head. Chief,
actually, I think typically we read the questions in again anyway, so we send those over just to make sure if there's any back end, if the questions require back end research, just to make sure that you have visibility. But we could ask in the questions because I think there was a couple. Ms. Johnson, if you still would like to go through, there was a few other questions for you. So
okay, I'm sorry. Yeah, I don't recall seeing them.
No,
I could just give you a couple quick things, and then whatever questions you have. Our traffic and community police unit has been working with the state on the road closures and the traffic control for the city parade on Monday, and also the We're Waiting parade on Sunday. And they're all set, as well as the state police for the highway. Regarding the reopening, so to speak, of the city with COVID decreasing, we have seen an increase in calls for service, obviously. We have seen an increase in traffic. But one thing that's been a surprise a little bit, we haven't got a lot of complaints regarding masks or people not complying with stores that are still requiring it. Because I notice a lot of restaurants and stores are still, by their choice, asking for people to wear masks. So we haven't had a lot of complaints regarding that. So that's been good. And then regarding the vaccine, we do not have a specific number. I know the last I heard, Deputy Chief Zeka is the one that's been coordinating our COVID response. But I think it was something around 65%. The issue has been since the official vaccines where we signed up through the city and through our department. Now, most people are, if they choose now to go, they didn't go earlier, are going on their own. So we don't normally hear whether they went or if they went. But the percentage is definitely not as high as we would like it to see. But I think it's been increasing as people have seen more and more people get the vaccine. More and more people that were hesitant are now starting to jump on board and get it. And with that, I'll open up to any other questions that you have.
Thank you. Questions from the committee? Ms. Johnson.
Thank you, Chief. Yes, I did have that on my list to ask because I know folks saw the Hour article about the Southwestern Connecticut Police Departments being relatively under-vaccinated. So thank you for that information.
Yeah, we haven't been alone. That's been a common theme among speaking to the other chiefs at our meetings. We're pretty much in line percentage-wise. It seems like it's been running in that 60. Well, it was running around 50 to 60. Now it's been like 60 to 70. There are a few smaller departments that have really high rates, but it seems like in the cities and some of the larger towns, the rates have been lower than people would hope.
Do the officers who aren't vaccinated, are they wearing masks, or is that something they could do?
Well, we asked them to follow the CDC guidelines.
Okay.
Again, we don't know specifically which ones are, which ones aren't.
Okay.
We have a pretty good idea.
Yeah.
But we haven't seen any. Thankfully, there's been no new cases of COVID within the department in quite some time now. So that's been a good thing.
That's good. Okay. Thanks for that. I do have other questions, but if others want to follow up on this particular question, I can come back. But Oh, okay. I guess
Stop that. The floor is yours.
Thank you, Chair. Thank you. Yeah, so also in the hour, and this was more recently, I heard from a couple constituents that were interested in learning more about that training on the blue envelopes that you all have done. And it just, some questions have come to mind about like whether there's an outreach plan for getting the word out about these envelopes, especially to Black and Latinx Norwalkers who are neurodiverse, if use of force, training in, uses scenarios where you're interacting with a neurodiverse resident. And those are just some of the questions that I think they've been crossing my inbox on that.
Now that you said that question, I did get that email because I remember neurodiverse and I had to look it up. So, so I did get the email, but I must have put it somewhere.
All good, all good.
I forgot. Yeah, the blue envelope. Well, going back several years, Attorney Spar in the Corporation Counsel's office, his son is autistic, so he's been very on the forefront of not just police training, but just in general, dealing with the autism community. So we started working with him years back, where we brought him in and he brought in people to start training the department on dealing with people with autism. Since then, it's become more normal around the state, and there's been a movement among at the state level to have that training. The blue envelopes, we kicked off that campaign. That was probably, I'm trying to think now, probably a year and a half or two. It was before COVID, so it had to be 2 years ago. The blue envelope campaign. And again, Attorney Spar was influential in getting us on board with that too. So we've been fortunate. He's kind of pushed us ahead to really look at that issue. So it's been incorporated in our training for many years now. And this year we brought in a little bit different training, a different trainer, but we've been doing autism training for several years now because of Attorney Spar.
Yeah, that's something I'm thinking, just riffing here, but getting the word out about those blue envelopes and getting them out to the community, I think could be really beneficial, given that I know that there have been instances of police encounters with autistic individuals where the outcome has been really escalating very quickly. And
I know we had done social media and things like that. I don't think we've done that recently, so I can re-engage our social media people to get some information out again to remind people about that.
Yeah, that's fantastic. Yeah, I just it's one of those issues, I think, to your point, that the prevention piece would be phenomenal, given that I can imagine being in the officer's position. If you don't know that somebody's autistic, you're not going to be clicking as to why this person may be processing information differently, and so that could escalate very quickly. Yeah. Great, thank you. Well, I have two other questions that came through my inbox from constituents. One about this constituent seemed to think that, and I'm living on my own street as an N of one, I would agree that I'm getting a lot more excessively noisy and speeding vehicles, motorcycles, cars. I know some of that is just the spring and summer coming out, but are you getting that? Are you getting any reports of that as well, like holistically in the city, and just in general, what can we do to reduce some speeding? Because I think I'm hearing reports of like some drag racing going on, stuff like that. I know it's fun and fast, but it's very unsafe. So yeah.
Yeah, the drag racing is on Route 7 from the on Route 7 on the highway going to Grist Mill and back. And we've been working with the state police. It's that state police jurisdiction, but we've been working with them on the weekends. What we've seen is through social media, there's car clubs that have very high-end vehicles. I'm not talking about kids that are just bringing their cars up. I mean, these are vehicles designed for racing and very high-end, expensive vehicles from all over the place. And through social media, they gather and they'll just announce they're going to be wherever at a certain night. And they'll be 2, 3 in the morning. They'll meet up. Several of them will block traffic so that the other ones can then race so people can't get past. So we've been working with the state police on that on the weekend nights. We've also been monitoring social media, following to see if we can pinpoint when they're coming back to Norwalk. Thankfully, they have not been back recently in the recent few weeks. I don't know if that's a case of the enforcement or they found a better place, or, who knows? Or just the fact that because we've been looking on social media, they've gone to different aspects to advertise. So that's really where we've seen the racing. As far as speeding, that's the number one complaint pretty much throughout the city. Every day, some street, whether it's valid or not, that's the number one complaint. So normally what we do is if we get a complaint, I send it to if it's not a location we're aware of, some locations are obvious. There's a few streets that anytime we do radar, you're going to get violations because it's a constant problem. But if it's not a street that we're already well aware of, the traffic unit will put up a box to track vehicle speeds and the number of vehicles and the hours, and then get that data for a week or so, and then we'll analyze it and see if there is a problem and when it is. And if that's the case, they'll assign officers to do selective enforcement, usually the motorcycle officers to do traffic enforcement there, or if it's a stop sign, whatever the complaint is. But speeding and traffic has always been and continues to be the number one complaint. And sometimes it's like I said, the residents believe it's speeding, but it's not once we do the data. But yeah, there's some roads that just by the design, since they repaved William Street, that's been a major problem. Pretty much anytime when we go East Rocks from time to time. I mean, there's a number of places where the officers go on a regular basis. And our enforcement of speeding has increased dramatically over the last few years with first of all, the creation of the traffic unit, and then the expansion of the traffic unit in the past couple of years, which we didn't have even, 10 years ago, we had no traffic unit. So it was left up to the patrol areas to do it in between handling calls and everything else. And it's tough to do when you want to set up and then you get a call and you're leaving and you're trying to get back. So they do it as well, but the traffic unit primarily is the one that handles those complaints and those issues.
Okay, so in the future, this resident could talk to someone at the traffic enforcement?
Yeah, or just shoot me an email. That's all.
Okay.
Most of it is through emails, either from a resident directly, through the city's customer service system. We get some complaints that are forwarded through there. As far as noise, loud motorcycles, that's something that's always on our radar. That's one of the pet peeves of the mayor. And he asked us every police commission meeting how many loud motorcycle tickets were issued the previous month as the summer comes, especially in Washington Street, that area where people are sitting outside having dinner and then they rev their engines there. The tough part is you got to be there at the moment that they're doing it to catch them. But when we do see it, and we have issued several for that, starting out this spring and as the summer goes on, officers are looking for that too.
Yeah, because I did resident who lives off Westport Ave wrote about that specifically. So thanks for the info on that.
Speaking about that, oh, sorry.
No, please.
I just wanted to thank you, Chief, because we have had your, I guess we had a motorcycle unit down on Witch and Hunt, and that had been a big concern of our neighbors. And I just wanted to pass along how grateful they were to have you come in for the last couple of weeks. You've been, intermittently there. So thank you.
Yeah, thanks. What was nice about that, we got a lot of complaints from the residents, but I also got a ton of inbox emails from the residents this past few days saying thank you and I forwarded those to the traffic unit. So it's nice that the people did see that they were there and, were addressing the complaints. So that was a nice thing.
They were very grateful, and they reached out to us as well, to Tom and me. So it was very appreciated.
Ms. Revelous.
I can't hear.
We still can't hear you. These city laptops. Can't hear you. We usually start picking you up when you keep talking, but we didn't hear you that time. So weird. Okay, we'll come back. We'll come back if you come. Any other questions for the chief? I know, Miss Johnson. Let's do
I
it.
got one more. I got one more. That's all right.
Let's do it.
All right. Well, this one was from another resident that followed up about that illegal dumping conversation we had a couple months ago. Again, want to thank you all for what you're doing, because I know Councilmember Keegan especially bringing this up. Do you have an update for this idea of putting up some cameras in some hotspots there? Any news on that, Chief, that we could, I don't know, even or should, because we're not trying to, alert potential dumping. Yeah.
Can you hear me?
We can hear you.
Yeah. As far as the police department, we don't have cameras like that, portable that we can put up that we can use to do that. I don't know that I'm not sure if another city department or IT has that. I don't think so. It wouldn't be something that would be live, maybe something that could be recorded, but I'm not really sure. We don't have a budget to buy those, nor have we requested them. So
I think we were doing that through blight enforcement.
Okay, maybe so. I don't know.
Can I go back to my question? Can I go back to my question?
Yes, please.
Okay, so I just was going to say, hopefully that because for our area, trucks are really an issue. So hopefully that would ever be addressed. But what came back to what you guys were speaking, I had a conversation about this with my mother. In outreach, is there any way to connect to like schools or local like, I don't know, medical offices, just to actually get like a synopsis of who and how many people with mental disabilities that are in our area? I know it may be a HIPAA thing, but just like you would have warrants, you know what I mean? Like you have a name, age, family, to know that this child may be autistic, or this person, may have a mental ailment of any sort, so that when at least if you get interactions between them and you run their names, you can see right off the bat that there's an issue here. Is there any way to do that, especially like with youth in the school? Because in the schools, we document any children who have any disabilities. In medical facilities, I know, for example, working with CHC, being a medical home, or even with the Connecticut, the Norwalk Health Center, they know who is working with their mental health department. Is there any way to work with that?
Well, I know that we can't get the data from those agencies.
Yeah, I
because
know
of
with
privacy.
HIPAA, I know, but
what we will do is, if we're aware of someone, we do have some residents, not a lot, but some, who have notified us that their family member has either a disability of some type, and it'll go into our system as an alert. So if they go to that house, it's more so, I would think, a lot more for people that have physical disabilities. So if there's a fire or something like that, they know that person, or someone who's on oxygen that needs electricity, so they know if the power goes out, that's a priority. But this is something that, back when I was on the state panel that was looking at this issue, working with the Department of Mental Health Services, they were looking at trying to figure a way statewide to develop some type of system, and they found it very difficult because of the restrictions on asking people whether they have a disability or not and what the disability is.
Is there a way then to maybe do an outreach to then families, just in that way of them coming forward, just like that? Like if you think, I don't know how to even say that, but if you want to aware the local police that you have a family member with a disability or whatever, like just giving that ability for families to come up if they want to, then maybe.
We can look into that. Yeah, we haven't done a major outreach like that, but we can look into it.
Because I think that one of the things that happened, and we were talking about, is because the officers understood that and would see the gentleman and know when he was disturbed or know when he was a little nervous, and they would see him and bring him right back home and develop the relationship with the family. And that's what you're saying. So just wondering if we can do that. That's all. That was my question. That's it.
Ms. Shanahan.
The lawyer in me gets a little anxious when I hear stuff like that, because I do feel as though there might be some privacy issues concerned, but I'm sure that's something that
I understand.
Yeah, maybe the legal department could. I had a different question. I was going in a different direction, which is, it seems like in the newspaper, there has been a lot of reportings of recent shootings in Norwalk. And I'm wondering if you're feeling like there's an uptick in crime and what this might be attributed to, and, you know, what your sense of order is in our city.
Yeah, I think overall, there has not been a real big uptick in crime. The shootings are related to specific individuals that are kind of in a back and forth. We're hoping that we're going to be able to get enough cooperation that we can, you know, arrest those that are responsible. In the earlier incidents, a lot of times people don't want to talk to us. So even if we know who did it and what happened, without being able to get cooperation, we can't make an arrest. So yes, there has been in recent past a few incidents that we had not had for quite some time. We went quite a while without any gunfire at all. But again, as things open up, I think, you know, crime is definitely going to start increasing again. But thankfully, so far, we have not seen a big uptick, but except for those specific situations I just mentioned in certain areas of the city.
Thank you, Chief. And then, Ms. Johnson, not to go past your question on the blight enforcement. You and I could actually take that, and I do remember that, and I did not follow up on that after the fact. So if it's okay with you, the two of us could take that as an action follow up after this. If that's all right.
That's great. Absolutely.
All right, fantastic. Any other questions for the chief? All right, Chief. Thank you so much for the updates. It was
I was waiting for Ms. Johnson's hand to go back up again, so I didn't want to.
I said one more. I meant it. I won't sneak in.
No, thank you. Have a good night.
Thank you. It was a phenomenal discussion this evening. I think we just need one more motion. Ms. Revelous, is that the motion to adjourn? All in favor?
Motion. Yes, motion to adjourn.
Happy Memorial Day weekend, everybody. Enjoy the
You too.
Have a great holiday, everyone. Thank you.
Happy Haitian Mother's Day this Sunday.
That too. Fantastic. Have a good night, everyone. Bye.